Are patients, currently that you're treating with COVID, are you toggling back and forth between high flow nasal cannula and non-invasive ventilation?
So primary strategies that we've used for COVID-19 have been one of the two, but I would say that we're probably not toggling back and forth between those two modalities in one singular patient. When you think about this type of respiratory failure that is caused by COVID-19, most of our patients are dealing with a type 1 respiratory failure, meaning that it's primarily hypoxic respiratory failure. And for those patients, we're initiating high flow nasal cannula if they fall within the appropriate, if they don't need to be urgently intubated. And the patients that we're choosing non-invasive are those that may have a component of type 2 respiratory failure or mixed respiratory failure, meaning they have some underlying condition that also predisposes them to impaired CO2 exchange. And so this might be your patient that has severe emphysema, or your patient who has OHVS, where primarily their PCO2 is going to be affected in addition to their oxygenation. So I would say that rather than going back and forth between two different modalities in one patient, picking the modality that you would feel would benefit your patient best, and if that fails, then moving towards intubation.